welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, super excited to have you here because we're bringing exciting conversations with leaders who are really painstakingly shaping the future of healthcare. And we're really passionate around access, innovation, adoption, leadership. And if it's your first time tuning in, let me just tell you a little bit about what we're doing here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within our space to life. And the aim is to highlight real people that are on the front lines, that are innovating, and giving them the platform to share their stories with the world. So we've got an amazing action-packed year. If you haven't checked out any of our historical content, make sure you hit the subscribe button now to get any new content that comes over to you. So very excited about our guest today is someone who demonstrates an unwavering amount of bravery, a commitment to innovation, and enduring compassion. So these are the qualities that really are fueling her mission of transformation within cancer care. So I'm honored to introduce Vanessa Johnson, the CEO of Navvisa. And Vanessa's journey towards creating Navvisa is rooted in personal experience, having shouldered the burdens of her mom's cancer diagnosis. And if anyone's been through that, you know how troublesome that can be. And there's a steep learning curve that she faced despite having an extensive 20-year plus career in biotechnology, specifically in oncology, that really sparked her intention to bring change to cancer care. So Navvisa offers a very unique model of virtual care, providing expert cancer care navigation for individuals that are grappling with a cancer diagnosis. And moreover, Navvisa employs licensed oncology nurses who take the reins in guiding patients and caregivers alike through this complex landscape of cancer care. So think of it in our first conversation with Vanessa, we talked about it as like Sherpas. So prepare yourself. We're going to dive deep into Vanessa's world, into her background, and we're going to spotlight her story and explore what kind of impacts she and her team are making in terms of the sphere of modern cancer care. So Vanessa, it's great to have you on as a guest today. Welcome.
Thank you. Thank you, Michael. It's great to be here. I appreciate the invitation, and
Yes.
I'm really excited to have the conversation today.
Yeah, so let's kind of dig in a little bit more. I mean, I shared a little bit about the reasoning why you started the company, but can you share a little bit more about sort of the overarching mission and what was sort of that the straw that broke the camel's back that made you say that there's got to be a better way here?
Yeah, I mean, it's a great question. I think that, anybody who starts a company and goes in and is a founder, you have to have passion behind you for sure, because it's a big commitment. And what drove me to this really was seeing how daunting trying to navigate a cancer diagnosis was, being an insider. I mean, if I had as much, if it took as much time and just heartache as it did for me when I had connections, I spoke the language, I really understood what needed to happen. I knew how to get resources I needed. I mean, I had everything available to me. And as a caregiver, so as you said, my mom was diagnosed, and then I was her caregiver advocate. And even with all of the benefits that I had going for me, the difficulty that is, just for everyone that is on a path like that, whether you're a caregiver or a patient, it was just, I thought, if I'm having this much trouble, it became like a second full-time job for me. How difficult is this for people who have never even had to access the healthcare system before, and all of a sudden are thrown into it with a cancer diagnosis, which is so complicated. I think it's a situation where people, when you're dealing with cancer, you're not just seeing one doctor and like a primary care and going along and being followed. You're being seen multiple times. You're getting poked and prodded. You're seeing multiple providers, a lot of times over multiple systems. if you're getting a bone marrow transplant or having to get any specialty types of treatments done, you may be going to 1, 2, or 3 even different healthcare systems. So trying to really navigate that by yourself, when you don't even understand the words they're using, I mean, it literally is like a different language. It's just difficult and daunting, as I said. So anyway, that is what gave me the impetus to start Navvisa. And it's really my experience as a caregiver that has laid the foundation for what we're doing at Navvisa, which is really filling those gaps that exist in our healthcare system for anyone who is traveling a journey with cancer, whether they're caregivers, as you mentioned, or patients. And the last thing I'll add is that our entire team is as passionate as I am about what we do, because we've all been there in one form or another, either as a patient or a caregiver. And so I think being able to bring that passion and personal experience to the table really informs a lot of how we're able to fill the gaps that we were talking about.
Thank you for sharing that. Having been through, my dad was diagnosed with cancer, and having to deal with that was like you, just a lot. And I remember initially where we were introduced to a nurse navigator. So the idea of having a nurse navigator isn't something that's novel. Where do you think Navvisa takes it to another level? Can you maybe speak to that with respect to the journey?
Yeah, and that's a great point. Nurse navigation, especially in the oncology space, has been around for over 20 years. And there's actually now an organization, AONN, that provides certifications for oncology nurses specifically to be navigators. So it has been around, and there's a lot of data that shows that when patients have a navigator within the system, usually that they're being treated in, their outcomes are better. Everything is better. Their experience is better. And so we took that model and really morphed it. So as you know, things have changed a lot coming out of COVID in the healthcare arena. One huge change is telehealth is now prime time. 5 years ago, people being seen virtually was really, even though the technology was there, it was just not an accepted practice. That is completely turned around, and now it is a regular practice for people to be seen virtually. So this enabled us to be able to scale what was actually started out when I first started the precursor to Navvisa some years ago. It was an in-person service. We actually were taking certified oncology nurses, matching them to a patient or a caregiver in person, and then they would see them in their homes. They would educate them. They would attend doctor visits with them, not virtually, but actually in person. And so that was a great service. People loved it, but not scalable. So as you can imagine. So now Navvisa has a nationwide team of certified oncology nurses. And the wonderful thing about telehealth is that our service is completely virtual. We're able to interact with patients like this on telehealth, also via text messaging and telephone. Our nurses actually attend doctor visits virtually through our mobile app. That's one big benefit that's very unique to Navvisa, that we're able to provide people. So I think that the taking what started as a very in-person kind of within a system, the nurse navigation that you mentioned, and we've really created a new and innovative nursing model that, because it's virtual, but also because we're using nurses who are practicing nursing. which is also very unique in this space. We're not practicing medicine. We don't compete as you or add on to the current clinical team that's treating the patient. We're very patient and caregiver focused and centered. So we just kind of are really, as you said, like the Sherpa that is walking this journey side by side with the patient, the family, the caregiver, but as a clinical expert. So it's so wonderful that our nurses are kind of like oncologists who subspecialize in different cancer types. So we're able to match our certified oncology nurses directly to a patient based on their type of cancer that they're dealing with, whether it's a patient or a caregiver, their geography. And then that nurse actually stays with them over time. So this longitudinal relationship develops so that that nurse actually understands what the needs of that patient are. And when I say they practice nursing at the very onset of that relationship, they do a deep dive and spend like an hour and do a nursing assessment, which involves clinical and psychosocial assessment tools, and that really enable the nurse to get a very clear picture of where in the journey that person is, what their needs may be, and how we can best support them and educate them to advocate for themselves, but to also have a better understanding of what is happening, what's down the road, what they can anticipate coming, and how to best prepare for that, how to give them the right resources at the right time. So that's what's, I guess, different from the traditional nurse navigator.
So there's as you started to kind of unpack that, there was several things that really sort of crossed my mind. You know, when you think about aligning the patient outcome with a clinician that wants to operate at a top of license without having any sort of additional constraints attached to them, productivity measures, all those other things. You guys have sort of skated around that, and I'm curious, how did you land on the I'll call it the financial model that you landed now? Because you're not actually billing in insurance, you're not doing any of that.
Right.
Can you talk about some of the reasonings behind where you thought it was the most reasonable approach to go specifically to employers? Can you maybe just sort of unpack that a little bit?
Yeah, you bet. So one thing that, like I mentioned, I did this is kind of the second iteration of what we're doing at Navvisa. And originally, we were really kind of going direct to consumer. So the patients were benefiting, definitely, and we were able to help them. But what we didn't like, and what one of the kind of our mission is to not charge the patient. They are already so heavily financially impacted with a cancer diagnosis. And so we looked around and to see what avenues there were in the market that we can still access the patient and the caregiver without them having to pay the bill. So who's experiencing a big pain point around that? And there are actually numerous organizations that would fit the bill, but employers really were the low-hanging fruit. So just this last year, cancer went from the number 3 most common expense in the healthcare realm for employers to the number 1 slot. So now employers across the country, their number 1 expense are their employees dealing with cancer. Statistically, 1 in 3 people will get a cancer diagnosis in their lifetime. Employers, even though there's a small minority of the total population that's dealing with cancer at any given time, they're accounting for 12 to 20% of the total healthcare expense for an employer. So the employer is wanting to solve this problem, not only from a return on their investment standpoint and ROI, but also to support their employees that are having to take leaves of absence and time off, or even just completely leave their career altogether. So to help support them. So the employer is motivated to bring us on board, to bring Navvisa on as a benefit. So the employer pays the bill, as you said, and then the benefit is free to any of their employees who are in need. They then can connect directly with us, and it's wonderful to be able to serve them. Because we're virtual, we're able to also help with equity, healthcare equity, reach people who are in rural locations, who we've, statistically, and we've found in our work that people that are in rural locations many times are not getting the same care that people in who may live around a center of excellence are receiving. So to help level the playing field, we're also able to do that as well. So that's why employers.
No, it makes a lot of
Long-winded
sense to go that
answer.
way. No, it's a well thought out, crafted answer. So just to kind of look back, when you think about as an innovator, you're constantly evolving and making changes, going from I'll call it, direct to consumer.
Mhm.
That's great, but you realize, hey, we want to access more people. There's only a finite amount of folks that would likely be able to afford what it is that we're doing. I'll call it this
Yeah,
concierge navigation. And then
right.
you kind of said, all right, how do we open that up? And then you basically say, okay, like we can make this virtual. That is something that is universally accepted now. Great, check the box on that.
Yeah,
And then the next note is okay, how do we find a way to be able to use this as a means, as a benefit to folks where they're not having to pay out of pocket for it. So I like the strategy in terms of how you've gone. What have you found in terms of just getting real for a moment? What have been some of the blockers? I speak to a number of folks, and there's a lot of noise around having multiple point solutions and going to
yeah.
employers. How have you found navigating that noise? Has it been difficult? Maybe just talk to that for a little bit if you can.
Yeah, I mean, it's like any new business entering the market, it is not easy. You're coming in as the new guy. The benefit that we had in this particular marketplace is that cancer solutions were kind of new. Really, there weren't a lot of players when we entered. I mean, we've only been out there for 3 years, so we still are very new. But I say the biggest blocker is really that in the employer benefits marketplace, the sales cycle is long, and when we started out, everyone was telling me, expect 1.5 years for you to close your first contract. And I'm like, that is way too long, that we've got to accelerate that somehow. But it, that is pretty normal in this marketplace. And I think that was probably the biggest hurdle to kind of get over at first. And we were very fortunate to be able to pretty much hit the ground running and get our first contract with a mid-size employer on board within our first 6 months, which was unheard of. So I feel fortunate that we were able to kind of, get some traction early. And that's kind of started our momentum, and we've been able to keep that up. But, it's still daunting. It's still, I think I'm like, just as being a type A, as you can imagine, that I want it to happen, yesterday, not 1.5 years from now. So, yeah.
Well, aside from continuously building out a pipeline, when you have clients that are onboarded and are coming on, how do you notify employees of this benefit? How do they normally communicate that out? Is that a process that you have control over, or is it more of a collaborative arrangement?
Yeah, I mean, it's usually collaborative, and it really varies based on the employer and their culture. And to just give you a couple of examples, one client we have, their employees are in multiple locations across the country. Some of them are remote, but some of them actually are are kind of like line workers, so manufacturing. So many of their employees actually don't even look at email. So they're like, so that's challenging because a lot of things you send out are like e-flyers or, a newsletter or announcement or something like that. So, with that employer, we worked with them to develop and send out postcards. We did postcard mailers, but then we also did flyers that they told us. So, we're like, what has worked for you in the past and how can we best access people? They said, one of the things we did that worked really well is actually get flyers printed up and put them on the windshields of their car in the parking lot. And that's how, they were like, let them know when they got something new or something they wanted people to know about, they would canvas the parking lot. So it just varies.
Yeah.
But I'd say, that's the exception to the rule. Generally, we're able to just work closely, and most, especially point solutions, but any benefit, people are getting about, if you're lucky, you get about a 3% engagement rate. An employer does with a benefit, because it is hard to get people to know that that they have these free benefits available. A lot of times there's so many of them. And so Navvisa has been very successful at engagement, because I think when people need the service, they really need it, right? It's not a dog walking service, right?
Yes.
This is so much more important. But our engagement rate has been between 18 to 25%. So much higher than the 3% that normally is seen.
Would you mind sharing some snippets, just even from folks that have gone through the experience with Navvisa? Like what has been some of the feedback, and to the degree that you're able to share?
Yeah, I'd love to give you some examples. One that just came to mind actually is a caregiver. So there are so many more caregivers out there that are working for companies that that they don't even know about, because usually they're kind of silent. They might not even share with their manager that they're dealing with a loved one with cancer, but they're taking time off and they're having to take them to the doctor's office, or they're trying to Google and find resources. So a lot of times these people are kind of just trying to go it alone. We worked with a caregiver who was with actually a large tech company, who was our client. The caregiver engaged with Navvisa. They got assigned an oncology nurse, and it turned out that her father was the patient, had just gotten a diagnosis of cancer, and before they could even start treatment, he ended up in the ICU. Well, she was kind of the primary caregiver of all the siblings. She had 8 siblings, so there were 9 kids. And he was in the ICU, and this was during a time when they were not allowing anyone to go into the hospital. So he was by himself in the ICU. They allowed one person in, and so this woman was able to go in and see her father. None of her siblings could go in, but they thought he was in the ICU and he was going to get better, and then he'd come out and start treatment. But the Navvisa nurse, knowing the situation, said, I think you need to get a consult with the physicians and really find out what's happening, because I don't think that's the path ahead. And sure enough, they got a consult, which they didn't even know they could do. The family was able to meet with the doctors, get this consultation, find out that he was actually not going to be able, they weren't even going to be able to send him home, or was he going to start treatment? He was actually dying. And so when they found this out, the Navvisa nurse was able to help them get connected and ask the right questions. Just go to the doctors, the providers, and say, we would like to see if we can bring him home, if he is actually, how long does he have? And so they were able to take him home. He was able to be with his family during his last days. And that would never have happened just because they didn't know what the options were or what questions to ask. So I think that's a huge difference in the outcome for the family and for the patient when just working with the caregiver and having an oncology nurse who really understands how to navigate, right?
Yeah, yeah. And I'm just imagining, I mean, stories are powerful, and how you can share those stories with others that might even potentially be able to, benefit from, learn from them. It seems to me
Yeah,
that, I haven't met anyone that hasn't been impacted by cancer.
yeah.
And so everyone has some form of an experience with
Hmm.
this. And now that something like this is available, my hunch is that, do you think that there are others that could try to deploy this? And what do you think is sort of the differentiator from what it is that Navvisa is doing that makes it so special?
Well, it's not, you can't get a patent, right? You can't protect your product in that way. I think what makes Navvisa special is we've created a work environment where the oncology nurses, I mean, we're kind of a known entity and something that's different. So one thing that people say are like, how could you possibly scale this kind of business because there's a nursing shortage and, that's just not possible. Well, there's not so much a nursing shortage as there is a shortage of nurses who want to work in traditional nursing roles, especially nowadays. The workplace for healthcare workers can be dangerous even, but
Right.
even more than that, they're not able to really have these meaningful relationships and help patients in a way that the reason they became nurses is because they want to help people. And oncology nurses specifically, because they are highly trained to help people through a cancer diagnosis. In the hospital settings, the clinic settings, they're not really getting to engage like they would like. So Navvisa is providing a workplace where they can engage, have long-term relationships with people, and actually practice nursing without having to worry about setting up appointments or going in and just seeing a patient for 5 minutes and then never seeing them again if they're in the hospital or in the ER or whatever the case may be. So it's a completely unique nursing model that we've created. Can people replicate this? They do. They would need the right personnel. I think one reason we've been able to be so successful at creating this new nursing model is because we have our chief clinical officer who came out of Stanford, Joan Forte. She was at Stanford for 30 years, overseeing head of nursing, among other hats that she wore. And so she worked with 6,000 nurses and hundreds of nursing teams.
Right.
So really understands how to put together a business, a company that is based on a nursing model. So, and it takes time, right? Just
Yeah.
like anything, to build something out like this. I mean, we have pathways that we've built. So there's a different pathway for a caregiver than there is for a patient. And there's a different pathway for patients based on where they are. Are they in treatment? Are they in survivorship? Are they at end of life? So we've built out pathways so that we can anticipate the needs of the nurses, how many hours we anticipate them being able to spend with each individual that we're engaged with. So there are many things kind of behind the scenes that we've worked out, unit economics, things like that, that are making us successful, and that will, as long as we're able to stay ahead in the marketplace, I think we really have an edge for people coming behind us who will
Right.
surely develop something similar. I hope they do, because there's such a need. There's
Right.
room for more than one of us.
Yeah, I mean, you mentioned it around it's more of a talent alignment issue. There's talent that's out there from a clinical nursing perspective. It's just, do they want to fit within the traditional role? And I think what you've done here is you've created a new category. You've
Yeah,
created less friction,
right.
where the things that nurses love to do, it's like, imagine
Yeah.
just doing that all day. I
And
mean,
doing it
not
from
at
your
100%, but
safety of your home.
doing
Yeah.
it virtually. Look, there's
Yeah.
some other elements that maybe they want, but let's be honest. I mean, the patient clinician relationship, that connection is paramount. Like,
Yeah.
to me, that's the secret. When you're delivering care, it's the care of that bond that occurs.
Yeah.
So how do folks, we're kind of getting towards the tail end of our time here, but I mean, how do
Yeah.
folks follow your work? How do they continue to follow your story? Can you maybe run a little commercial for Navvisa and just share with everyone
Yeah.
how they can kind of keep up with you all?
Oh, yes, please. So we have a website, www.navvisa.com. We have a blog there. We are certainly on places like LinkedIn. I'm on LinkedIn, and I'm happy to talk to anyone who's interested in learning more about what we do. We have salespeople who are out in the field, certainly talking to employers, but anyone who wants to connect with us, I think the best way is through our website. And they can also, there's a place on the website, we have a white paper that we just published that's available there on ROI and cancer for employers. And then they can also go through info@navvisa.com, and my email, reach out to me, Vanessa@navvisa.com. So we try to make it as easy as
Amazing.
possible.
Yeah, make it accessible. I think what
Yeah,
we'll do is we'll list all of those in the description of this video, so everyone will
thank
be able to
you.
have access to all those documents. And just from our standpoint as a community, where we're looking at advancing healthcare forward and moving things in a direction that I think impacts humanity at large, how can we add value to you? How can we support what you're doing?
Well, we are fundraising right now. So that's always, if there are, I'd say, anyone who's interested in investing in this type of work, certainly get in touch with us. But I think too, what we're doing is really what we started out the conversation on. We're filling those gaps in the healthcare system. That is not easy. I mean, providers are working night and day. They can't even fit another patient into their schedule. And to have to use the nurses that are actually the most trusted providers in the system is the nurse. People trust their nurse, and to have a nurse that can be with you throughout your journey and be accessible. You can send a text if you have a question, or they can help you with side effects. I mean, it's I guess to have people think about how they can utilize a service like ours. And like I said, there are some fantastic cancer centers across the country that have nurse navigation. Find out if there's one near you. If you're dealing with this, get in touch with the nurse navigator. Call us. We also do have individual plans available for people. So if your employer is not connected with Navvisa or contracted with us, you can also
Right.
go to the website. We sell individual plans, and you can use HSA for those as well.
Oh, that's super
So
helpful to know. Very helpful to
yeah,
know.
it took me a while to get around to that. Sorry.
You could, because you answered my question. I was going to say, well, what if you're an individual and this isn't a covered
Yes.
benefit? Are there other ways of being able to leverage that? So that is fantastic that you
Yeah.
can serve the individuals that have a desire. So we'll make sure that we list that in the description. So for those that have just kind of listened in on this conversation, if you found this conversation to be helpful, would you mind sharing it, liking it, acknowledging it? And I'm very grateful, especially when we have folks that are coming onto the show that are really trying to make a difference, for us to support them and to help lift them up. So, Vanessa, it's been really fun having you come onto the show, and I mentioned this to guests often is we want to hear from you. We want to hear about your story. We want to hear more about your journey, and
Thanks.
if that means coming on at another time,
Yeah.
we welcome that also.
Thank you, Michael. Well, I'm so appreciative of you having me on and highlighting what we're doing. It's really great. I love what you're doing as well. So thank you.
Thank you very much. All right, we'll be
All
talking
right.
soon.
Okay, thanks.